Welcome back to HealthWise. With us is Dr. Carl Gonsoulin. And Doc, let's talk a little bit about pediatric dentistry and basically what's your, I noticed on your shirt it says good teeth for life. So how'd y'all come up with that motto?
Well, you know, somebody came up with the bright idea and I really like it. I think it really expresses the idea of what we're trying to do here. We're not trying to, we've done no good, I feel we've done no good if somebody ends up with dentures when they're 50. You know, they came to us and next thing you know, they got no teeth, okay, all right? And that's not, teeth are very important for many, many reasons, and a lot of reasons we don't realize. There's a strong connection between gum disease and heart disease, and you have an infected tooth, like an infected toe or infected foot or anything like that, it can get to be very serious and life-threatening. Fortunately, it doesn't happen often, not to mention the pain and discomfort involved with it. And some kids or people have, their teeth have been such a problem to them, they come up with no teeth, no problem, and then they have more problems because now that there's no set of dentures that are as good as the real thing. So good teeth for life starts off in infancy. It starts off with the parents knowing when the teeth are there, the food is there, the germs there, everything there needed to cause the problems are there, so they need to get trained up, or they need to get the information on what to do to prevent the problems before it gets a chance to start. It doesn't take long for a tooth to decay, a baby tooth to decay under the right circumstances. And if they're taking this bottle while they're sleeping at night that would contain milk or juice or formula, just about anything but water, it's bathing these teeth with food all night long. In a few months, they have very, very big cavities, needing lots of work. You know, and that's their introduction to teeth, and so that's not a great way to start things. Plus, it puts a pretty good strain on the budget, and that's all unnecessary. You know, say if the parents would learn what they need to know, very easy to take care of the problems, okay? And then teeth are a benefit to you, not a problem.
Okay, we were talking about what you're saying about, you know, the kids needing to come and get checked out. How early is too early, or is there such a thing as too early to bring your baby to the dentist? Well,
really, there isn't anything such as too early. We want to see the children before age 1, not so much to see the child, but to see the parent. Okay, they generally get their first teeth somewhere around 9 months. So around 12 months of age, 3 months their teeth have been in the mouth or so, all right? So it's a good idea to see the parents either at that time or before the teeth have a chance to come in, so we can tell them, this is what you do to prepare a child for teething. You know, he doesn't know what's going on. Now he'll notice his mouth is hurting. So bring him to the mirror and kind of show him your teeth and tell him what's going on. Tell him, let him know that it's okay, you know, and that you're there to help him. And so he doesn't have to quite panic. He might be panicking when wondering what's going on with himself, you know. And, but get the information so you know how to prevent the problems before they happen. It's actually quite hard to get cavities. It takes a lot of factors to get cavities, and it's fairly easy to prevent it, you know. If you know how to brush and floss, and if you can get that worked in, you know how to handle a diet so they're not getting the wrong things at the wrong time, okay, then it's pretty hard to get a lot of problems. Okay, you may not be able to prevent braces if you got grandma's teeth and grandpa's jaw, they may not fit right, you know, but that's a minor problem compared to, you know, all kinds of crowns and cavities and things like that. The treatment that needs to be done to take care of.
Sure. What, you mentioned flossing. A lot of people, myself included, hate flossing. Why is flossing so important?
Well, no matter how well you brush, unless your tooth is by itself, you can't clean that tooth. You can't get the tooth between the teeth. It doesn't fit. Right. So you're leaving about 40% of the tooth unclean.
Wow, okay. That much?
Well, if you take a back tooth, there's 5 areas. Right. 2 of the areas, you know, it would be 40%. As much, and so that's quite a bit. And that's where most of the cavities occur because it's not clean, and that's where most of the gum disease occurs because it's not cleaned. Right. Okay? A clean tooth cannot get a cavity in most cases. It'd be very difficult to do. Okay. Right. And it can't get gum disease in most cases unless there's something else that make it impossible to keep clean. Some of these teeth, the back molars, have very deep grooves that are uncleanable. because you can't get that toothbrush into that deep groove, okay,
Right.
just the way the tooth is made. That's a natural formation of the tooth. So we have sealants, that these plastic coatings that you can paint into the grooves, that it can help seal off these grooves. That it's a painless procedure. You don't numb it, you don't do any drilling, you just paint it on the tooth, clean the tooth and paint it on. And it works very well in slowing down or preventing most of the problems that occur on the biting surface of the teeth. You still have to brush, you still have to floss, okay? All right? Now, flossing, the only thing that makes flossing the difficult thing is you're not flossing correctly. So you want to make sure that you know how to, you know, some people can use their hands better than others, so you get an instrument that can hold the floss for you if you have trouble
Yeah, they
using
have those
the little floss holders and stuff like that. And get a routine going on. The hardest part is getting the habit of doing it.
Right.
Once it becomes a habit and routine, it's easier to keep the habit in, and it's very, very effective.
Okay.
So we do recommend that strongly.
Well, great. Well, we got a couple more minutes. Well, we got about 20 seconds left, not minutes. But just want to ask one question, quick. Hard toothbrush, soft toothbrush, what's the best?
Soft toothbrush.
Okay, got it. Y'all heard it, soft toothbrush, because a lot of people think the harder the toothbrush, the better it is. But okay, Doc, well, we're gonna end this session, and we're glad you came, and come back anytime. And thank you for joining us on HealthWise. We'll see you next week.
Honesty. Pass it on.
You're watching KDCG TV, uniquely Acadiana.